think it's too early to say anything, as you are saying, but there is a possibility.
The current data that we are having is still very limited. So there are so many additional characteristics of this virus that the researchers are busy studying, of which transmissibility is one of them. Severity is also another part. So we need also to find out if it's not going to be affecting the current vaccines that are in use.
It's consisting of about 10 to 14 mutation in this area, especially.
And there's quite a lot of other pending samples that the research network is busy working on. So the numbers, they're going to keep changing all the time, and we are even expecting worse than what we are seeing currently. So there is a very high concern, meaning that it seems as if the majority of the people that are infected by this variant is quite an age group that is having a high possibility of really taking the virus all over at any time. And it's even worse now. We are going to the universities and schools are going to be closing, and there'll be so many lots of activities that might be taking place. And so that is one of the concerns that the country is facing related to the current status for this variant.
And at that time for Botswana, I think estimating the variant were even less than 10, I think about 6.
Because even though it was mentioned earlier on that this variant can be detected using the diagnostic PCR, however, that marker that we see in the diagnostic PCR, it still needs to be confirmed by the genomic sequencing or the sequencing itself. So therefore, we are working closely with all the countries in the entire continent to make sure that we are really upscaling their sequencing. We are working around the clock to be in touch with the countries, to advise the countries what needs to be done, because we still need to make sure that the countries, that as much as we don't have a very good vaccination in our continent, if I may put it, our continent at large, but people are still encouraged to make sure that they follow all the public health social measures. You ask yourself the question that was it a wrong approach for them to come transparent or what? So these are the things that we really need to put it very, very, very clear and transparent to the world, that reporting something of danger is the very best tool that we can do. Firstly, we are trying to warn the other country of the emergency that might be coming through. And those countries, they're going to now try their level best to get prepared of if should this particular pathogen enter into their territory, what they're supposed to do. But closing the borders or banning the certain countries for entering, I don't think is an answer. If we're still going to continue with the vaccine iniquity in the world, definitely we're going to still seeing this kind of set events taking place, like the variants coming up, and then we are not fully covered for that matter. And those that are having the access to vaccine, they're also the first one to get worried, because they will not allow people from Africa to enter their territories. So when it comes to that, the inequity of vaccines still needs to be really looked at, and they need to try to support Africa as much as they can.